This is just a great story of why working together as a team not only is a benefit for us as the professionals that work together because it makes our job a little bit easier if we're all on the same page, but the people we help. And this is, I don't want to call her a client because she's not a client of mine. In fact, I think she came to a Social Security class. Let's call her Mary. And Mary came in and had questions of me, and we're going through the motions and having that first appointment, getting to know each other a little bit, answering some questions she has. But then she starts bringing up a lot of questions that I'm like, you know what, Mary, this is why we have team members here. Let me grab a Medicare professional or a healthcare professional, because Mary was still working and she had her employer coverage and she had Medicare, and normally that's not even really worth it. But in this case, you said she's been having some issues for the past, 4 or 5 years?
Yeah, Matt, and I'm going to go back to your last segment. You said something that resonates very true with this situation, and I find myself saying it frequently. We're going to take it easy on you because this is your first time retiring.
Yeah, that's right.
We understand that you haven't been through this type of process before. And for Mary's unique situation, she was still working, and whenever she first decided or whenever she first turned 65, she applied for Medicare Part A only and had deferred Medicare Part B. And she had been that way for about 6 months until she had gone out to a breakfast with some of her gal friends. And her friends were just absolutely shocked that Mary didn't have Medicare Part B. And she was told by this group of people that, these are her gal friends she's going out to breakfast with. They're close. They've known each other for years. And she's being told, no, you have to take Part B. You're going to be penalized for the rest of your life if you don't take it right now.
But that wasn't true.
It wasn't true. And unfortunately, I hadn't been known Mary.
We had not entered the picture yet.
No, not even close. So Mary, to her friend's advice, decided to get enrolled into Medicare Part B. So for the past 6 or 7 years, Mary's been going with Medicare A and B and maintaining her private employer's group healthcare coverage.
Now, there's not, correct me if I'm wrong, because you will, but number one, but number two, this is your area. This is, again, why the advisor needs to work with these people in-house. Is there any benefit to being on Medicare and your employer coverage? Because they don't really probably complement each other very well, do they?
Yeah, Matt, that's a perfect question. And what benefit could we see out of that? And really, whenever we look and compare Medicare coverage versus a group health care, never have I made the recommendation, now that it may change in the future, but as of now, I've never made the recommendation that we should take Medicare A and B and maintain the private insurer coverage. It really needs to be one way or the other. And the biggest reason why is that those are two forms of primary insurance.
And so when you have Part A and B, let's take the group, because I'm gonna work through this the only way my brain knows how to work through this. Part A and B, A is your hospitalization, B is your outpatient stuff, and B doesn't pay for everything, pays 80-ish%. And then you pick up a supplement to pick up the rest, or you go Medicare Advantage. There's either or, and I know that's a polarizing statement just right there, but it doesn't matter to me.
I'm following you.
Right? So then, does the group health plan help pick up that 20% that Medicare Part B? Who gets billed here? I mean, you gotta wonder: is this just Medicare pointing their fingers at the private insurance or the group health insurance, saying you guys pay, and is the group health insurance pointing their finger at Medicare and saying you guys pay? Is this? I mean, there's a lot that could go wrong here.
Well, Matt, I know you have health insurance, and you know how difficult it can be sometimes whenever, you go to a doctor and something gets coded wrong. And then next thing you know, you're sitting in your office with your door closed for 2 hours trying to argue with people on the phone about who needs to pay this bill, who needs to pay that bill. So whenever you have two forms of a primary insurance, that argument is always happening. And just as confused as, I like to say that you do know quite a bit about Medicare more
only
than the
because I
average
ask you
person.
guys. Only because I ask you guys.
How do you think that when you go to a doctor's office, there's people behind the front desk that their job is billing. and they're handed a Medicare card and a group health insurance card, that's not a common situation that they get. And then on top of that, if they do make the mistake and Medicare doesn't get billed first, private insurance gets billed first, something's not covered here, and they try billing the other person, to go back and untangle that mess, Mary knows how bad this mess is, because typically we're having Medicare pay as a primary for her and her group health care come in as a secondary. Now, even though that group health is coming in as a secondary, it is not built the same way that these Medicare supplements are to perfectly complement Medicare. So anytime Mary's had to go to the doctor, even though she has two forms of primary insurance, which rationally may sound like it's better coverage than a primary and a secondary, she's still being left with a gap at the end because neither one of them are intended to fully cover.
Yeah, really, it's almost like you have. I don't know how to an analogy that would work here. It's almost like you have two front sets of tires. It's like, no, you need the front tires and the back tires or something. You have the both primary insurances that's not really covering all the other. What have you recommended here? Does she stay on her group plan? Does she drop Part B? I mean, does she go get a supplement and drop the group plan? I mean, because there's not really, she's paying for two different insurances that are not covering her two. It's really a mess.
It really is, and it is a lot to untangle. Now, for Mary's situation, since she had started with Part A only and added Part B on later, we cannot go back now and remove Part B. They see that as a Part B removal for a second time, and that's something where the federal government is stepping in.
They won't let them do that.
Won't let her do that. Now, if she started with A and B, there's a good chance that we could get Part B removed. But for Mary's situation now, what we're having to do is we just have to either A, she has to accept life for what it is and keep the two forms of primary insurance, or B, make that jump. And even though she's still working, be completely off of her employer's insurance and moved entirely to the Medicare system.
So you're still working with her?
Still working with her.
Do you mind if I give you a small tip?
Let's go.
I would not give her options as in you have option A or option B. I would do it as an option 1 or option 2, because the Part A, Part B, the supplement, all the too many letters.
Medicare with alphabet soup.
I wouldn't give her options in that way. I would structure it in 1 or 2 and not all these stupid alphabet and soup. So, think about this, guys out there, if you're listening or watching. In this moment, the financial advisor had a resource where they could pull this person in and help navigate this tangled web of mess she trusted her friends to give her the right advice, and her friends were kind of right, but her friends could never even anticipate that this advice that her friend had given her was going to cause her. And if you don't have a team that's helping you navigate all these challenges, and as you transition into retirement, reach out right now, 833-888-HOUR, or that's 833-888-4687. Or pop over to that website, retirehour.com, and book your complimentary visit with this complete retirement team in any of our offices across Kansas City or Wichita. Well, stay tuned. We'll be right back with lead estate planning attorney Gerald Eidelman right after this.
Got retirement questions? You can submit your financial questions to be answered by the Retire Hour team by going to retirehour.com and clicking Submit a Question. We may even answer your question on air. Visit retirehour.com to ask your retirement questions today.